Okay, thank you, Jessica. Okay, so RN care coordinator. Okay, great. Connie, yes. I see you there. Okay, well, thanks everybody. Oh, I see a few more. Okay, population health, RN care, another RN care coordinator. Okay. So nurses, social workers, great. Health department. Okay, super. Super. Okay, well, I think we can go ahead and get started with our slides, and some people hopefully will join us as we're getting started. So my name is Megan Rooney. I am with Health Literacy Media. We are a health communication nonprofit based out of St. Louis, Missouri. So we're close to Kansas City. We've been working with Kansas City for about a year and a half now on a big grant for communicating different health literacy issues around COVID specifically. Hopefully some of you have seen or heard about our past trainings. We have, I think, somewhere around 16, 17, 18 trainings we've given in the last year and a half that all exist on YouTube page of Kansas City. So we do refer to a few of those throughout. So definitely check that page out if you want to see past presentations of our health literacy work. This is going to be our last training in this series, but we are in the process of developing some online e-learnings that people will have access to as well. So our topic today is going to be overcoming barriers to medication adherence. And I hope this information is helpful to you because as nurses and social workers, I'm sure that you and people that you work with or supervise possibly are working directly with people and sometimes around their medication. So please feel free to turn on your camera or unmute if you have a question or a comment. Also, we're monitoring the chat, so please feel free to use the chat as much as you like, and we love your comments and your questions. Oh, and then also afterwards, in the next day or two, we'll be sending a summary of this presentation, along with a link to a short survey to take about the presentation. We'll also paste in the survey at the end of our time today. So what we'll include in our discussion today, barriers to medication adherence, health literacy tips for improving medication adherence, and resources to learn more. So first, what is medication adherence? So just so we're all on the same page. So the World Health Organization defines it as the extent to which a person's behavior, such as taking medicine, following a diet, making lifestyle changes, corresponds with the agreed recommendations from a provider. This meeting is being recorded. I'm going to mute you if you're accidentally on mute, but feel free to unmute if you have comments or questions. So this definition stresses the importance of a partnership between the patient and provider, with both of them agreeing on the provider's recommendations. That's included in this discussion from the WHO, that it's not just this top-down approach of, well, the provider said it, so you need to do it. But as you'll see in some of the topics we discussed today, thinking of medication adherence as kind of a dialectic, so a conversation on both sides, a provider giving the prescription or the recommendation, the instructions, and then the person on the receiving end hopefully carrying that out as best they can, but also feeling free and open to discuss why that might not work for them, what might help them, what tools might help them adhere to their medicines better. So thinking of this as kind of a fluid process as opposed to this top-down approach of you do what you're told, basically. So non-adherence is a serious problem in the US. So 30 to 50% of medicines are not taken as prescribed in adults with chronic illness. So a lot of this is about people with chronic illness because, as we'll see, they have higher rates of medication non-adherence. And also, I want to mention with the word non-adherence, we're using it here because it has meaning to us and we want to be clear around what we're talking about. But, we'd never want to call someone, they're non-adherent, or what's the other word that people use? I can't remember right now, but when someone's not non-compliant, so those terms are phasing out in healthcare, and especially around in health literacy, which emphasizes, respect and partnership with the patient or with the client or the person you're working with in the community, whoever it is you're trying to help or serve. Just using that framework of, this is not a blame, this is not a name. We're not calling people names, but we're using the term to explain, a concept here. So this is associated with an estimated yearly 125,000 deaths. 10% of hospitalizations are due to medical non-adherence, and an estimated $100 billion in services. So it's a big issue. So like I said, so people with chronic illness have lower adherence rates. So people with chronic illness, such as asthma or COPD, have lower adherence rates than those with more acute types of cancer. And adherence tends to drop after the first 6 months of treatment. And then we're going to go through, before we get into the tips, we're just going to go through kind of the different levels of medication non-adherence. So again, moving away from that, we're blaming the patient or the client for not taking their medicine correctly. And we're recognizing that there are reasons for this at every level of the spectrum of the care continuum. So these are patient factors. Then we'll discuss provider factors and system factors. So patient factors in medication non-adherence might be not understanding the reason they need the medicine, which is related to motivation, which we'll talk about in a minute, low health literacy. And if you've watched any of our past presentations, you'll know that we like to state everyone has low health literacy at some point. Some people tend to have lower health literacy. Some people tend to have higher health literacy, but it's a spectrum, and at different points in time, we move along the spectrum. So if someone has, less ability to navigate the healthcare system due to health literacy or English proficiency, that can definitely impact medication non-adherence. And then lastly, a lack of confidence, which is related to health literacy, but a lack of confidence in their ability to follow the recommended treatment regimen, especially if it's complicated or if it's for a disease that they are worried about or feel fear about. There's a lot of emotional factors. So now we'll move to provider factors. So not blaming providers, but recognizing that, again, there are factors at all these different levels. So what are provider factors that might impact medication non-adherence? Communication skills. And that's kind of where our company comes in with and can help with. That's what we do every day with all of our different clients. And it's a big piece of this project with Kansas City Health Department, teaching communication skills, including, you can watch our past presentations, but including not using jargon, using the teach back method, focusing on action steps, using supportive tools to help people, building relationships and building trust. As social workers and nurses, you know the importance of that relationship and building that trust. Not every provider out there understands the importance of that in helping people, take the healthy steps they need to take. And then lack of positive reinforcement. So why should I take this? What will I get? What will, how will it help me? How will I be supported? And then lastly, we can look at system factors, which I'm sure many of you come in contact with all the time, that is much harder to change than these other factors. So unclear medication labeling and instructions. Like, we do all kinds of trainings on this, like these very complicated labels that have little icons that don't make sense, and the instructions aren't specific enough. Changes to the list of medicines an insurance plan will cover. So that's when changes in the drug formulary can be very confusing to people. If all of a sudden a medicine is not covered by their insurer, maybe they just stop taking it. And then patient education materials that are too high of a health literacy level or not culturally or linguistically appropriate. So some of these things are easier to change than others, but they're all a challenge, and they all impact people's ability to take their medicines correctly. So a quick question for you, like, how does this resonate with you? Are there other factors you see in your work that are not included here? So just take a minute to think about that, and feel free to write something in the chat. I'll give you like a minute, or you can just kind of think it over in your head, but just wanted you to kind of toss that around. Stress. Okay, so the emotional factors. Age. So another one about age. So older adults overwhelmed when coming home, so many meds, old and new, and sorting through them. Yeah. So feelings of overwhelm, older adults, general stress or stress about a condition or other life stress, finances, big one. And connected to insurance too, right? Like, if it's covered, but it's too expensive, how are you going to get that? And if it's not covered, then it's super expensive. How are you going to get it? Yeah, absolutely. So some of these are patient factors. Some of these are system factors like finance, how much things cost. Okay. Yeah, these are great. These are very good. So in our tips, that's really helpful for me. Oh, okay. Older adults have trouble seeing and deciphering meds too. Okay. So like the physical limitations of vision problems or aging as your eyes get weaker as you age. Yeah, that's good. So I'm hoping some of these tips can help with that. Let's go through it, but that's good. I'll have this in the back of my mind as we're going through and try and think about how these tips relate to these challenges. Provider time limits, Connie said. Yeah, I don't know what you do about that. That's a provider but mostly that's a system issue. Yeah. Okay, that's very helpful. Thank you. So we'll move on to a couple tips. And again, I hope that these are helpful for you. So I'll just kind of there's 6 different interventions that we have here today. So the first one is educating the patient, which again, as nurses and social workers, I'm sure that you do a lot of education. So taking the time to, even though you have time limits on you, as Connie stated, taking time to sit down with a patient, map it out for them, understand how they learn, understand what tools would be helpful to them. Ideally, you would have time to do that. I know a lot of people like things written out, especially older adults, like they might have a notebook where they keep all their notes. The next one is just help managing the regimen. So that's like different tools that are available. Consultations with pharmacists. So I don't know how much your patients or your clients use their pharmacist for help, but I do find in the US, it's kind of an underutilized resource. But that's a way to help people, is to connect them with their pharmacist. Cognitive behavior therapy, which a lot of you know about. We're not going to get too into that. We will talk a little bit about motivational interviewing, but you know, how can we help people kind of lower their stress level by offering some basic cognitive behavioral therapy? We only have 30 minutes today, so we cannot get into CBT, but it's a proven way to help people lower their stress levels, because it focuses on their thoughts and their feelings and their actions. So, what thoughts do you have when you sit down and you see 100 pills in front of you? Like, what is your first thought? How does that make you feel? And then what do? Then you shut down, then you don't do it. Or, when you see the price of your medicine, what do you think in your head? How does that make you feel? And then what do? You just don't get it. I just don't take the medicine. So then how do you connect those three things and kind of intervene along the way? So let's try and rework those thoughts. So that medication is expensive, but I'm going to see if I can find some help to pay for that. Maybe my pharmacist has a coupon, or I can call my insurance, or, so different strategies to work on thoughts, feelings, and behaviors. Next is find medicine reminders, which we'll touch on a little bit, but like things like apps, which again, with a lot of older adults or even some younger people, the digital world is not as tangible and accessible as something that's physical in the world. And then checking in with insurance, seeing if there are incentives to either help pay for a medicine or incentives to take a medicine and to take it correctly. So those are some ideas. We're going to go through a couple of tips here. Tip number one is explaining their condition. So this is all around education. So again, taking the time to explain the health condition, supplementing that with printed material can be really helpful, especially thinking about older adults, that we have learned in a lot of our audience testing and conversations in the communities. Many older adults, but also younger people, really still value something written, a fact sheet or a guidebook, or just something that is very clear and walks them through how to do something, like how to take a medicine or what days to take which medicine. People still really value the print, and I don't know if that's your experience or not. Using the teach back method, we have a whole training. Actually, I think we have 2 trainings on this that we've done. So learning to do teach back, which most of you probably know about, but if you don't, the basics are that you provide some education and then you ask for the person to explain it back to you. And it's a test of your explanation, not a test of their knowledge. And if they get it wrong, you say, oh, I did not explain that well enough. Let me try a different way. And you try a different way. And then you kind of continue that process until they get it right. And moving through that process, there's a tremendous amount of data to show that moving through that process alone helps people understand, comprehend, and then take the correct action. So using Teach Back is a huge recommendation. And if you want more training on that, please visit the KCHD YouTube page and you can watch that past training. Also, when explaining, next slide, Jeremy. I forgot to mention that Jeremy is here helping me with slides. Jeremy Day is also here. So here's some example handouts that we've created for different clients. The one on the left is for Kansas City Health Department. The one on the right is for a St. Louis organization. But one of those system factors was documents that are too difficult to navigate and too difficult to understand. So that's where health literacy can come in. Creating materials that are visual, that are simple, that are a low reading level, really tailoring it to the audience. And maybe it's someone who's non-literate. So then how do we make a material that's just visuals to show someone how to do something? That's something we can help with. That's something we do all the time. Also, just doing quick Google searches. Sometimes you can find materials that other people have made and published. Tip 2 is to avoid jargon. It's hard when you're working in healthcare to not use the jargon that you're trained on and that you use to communicate with other professionals, but it is kind of switching gears when you're working with someone from the community, not using words like these. And so really quick, what are some words you might use to replace these? So mitigate, complete jargon, like, people don't walk around saying mitigate all the time. If, people that you might meet throughout your day. So what's another word you might use for mitigate? Any ideas? You're still thinking. Reduce. Yeah. Reduce. Yeah. I see two people say reduce. Reduce is definitely simpler than mitigate for sure. Lessen. Lessen is great. I think that might be what we put on here. Is that right, Jeremy? Remove, get rid of. Yep. It depends on the context, but to get rid of, to remove, to lower, I always say, like, how would you explain this to your grandma or to your little 5-year-old? Like, you wouldn't say mitigate. Administer. Take or give. Yeah, take or give. And those are great because they're one syllable, which is going to lower reading level if you're writing something. Okay. Annual. Maybe somewhat more simple. Yeah, yearly. Yearly. Contusion. Scrap, like maybe just get rid of it. Melissa, is that what you're saying? Bruise. Yeah. Oh, scrape. Okay. Scrap also, because maybe you're just like, I'm not going to use that word. Yeah, a scrape, a bruise. I remember I was told I had a bump. I was told I had a contusion one time, and someone asked me if it was a bruise, and I said, no, it's a contusion. I did not know that they are really considered the same thing. Define jargon. So sometimes you have to use the word. So for anemia, we would say you probably have to use the word anemia because it's the name of a condition someone needs to know. So we would define it. So Jeremy, you can kind of click through these. So you might say, well, you have anemia, which means you have a low number of red blood cells. And then you could go on to explain like what that means. Or glucose. Probably going to need to know glucose because that's used so much in especially diabetes management. So you might want to say, well, glucose, it's the same thing as blood sugar. Okay, moving on because we have 6 minutes left. So number 3, explain the medicine. So there's research to show that in office visits, back to Connie's point, doctors spent an average of 49 seconds talking with patients about a new prescription. So 49 seconds is not very long. So taking the time to explain how and why, especially the why, really matters to help lock it in and make it relevant to someone and gives them motivation. So little tips here, ask if they're reluctant. So ask, like, do you have worries about taking this? Do you not want to take this? What worries you about this? Maybe it's side effects, and then you can have a conversation about side effects. Discuss their beliefs and knowledge about their health. Maybe they don't believe this medicine is going to help them or is helping them. And then that can give you kind of open a window to a deeper discussion around what are their beliefs. Again, back to cognitive behavioral therapy, like what are their beliefs about this? How much do they know about this? How can we educate and help them with tools to then change behavior? And so I do just touch on motivational interviewing here. Again, probably a skill, a concept that many of you know or even use, but it's a collaborative conversation to strengthen a person's own motivation and commitment to change. And this is important in medication adherence because you can't tell someone to do something. You can't make someone do something, in this context. But MI is a proven way to help people find their own motivation to do something. So it's used to elicit their motivation to change a negative behavior or to make a decision. So some of you may have seen the stages of change. And so this is these 5 stages that people move through as they're making a decision or taking an action. So there's pre-contemplation, which is at the very beginning. There's no way I'm taking this medicine. There's contemplation, which is I'm worried about the medicine, but I know that side effects are low. So I'm kind of like thinking about it, but I'm not sure. Preparation is like, I think I'm ready to take the step. Maybe I'll see if I can talk to my doctor. Action is like, I've tried it. I might have some questions or some worries, but I've at least taken the step. And then maintenance is I'm doing it, I'm taking it, I'm doing well, like, no setbacks so far. There might still be setbacks, but maintenance is like medication adherence in this context. So a little bit about motivational interviewing. So explore their motivation and their beliefs. And there's a few different tips for doing this. So you can use open-ended questions. So if someone might say like, well, I don't want what my neighbor has, or I don't want to lose my foot, for a diabetes patient. Well, tell me more about that. Tell me more about that. Open that conversation up, have them explain more. And then you're listening for little clues to why they might not be doing something, taking their medicine. Exploring pros and cons. So what are the good things about this medication? What are the bad things about this? What do you not like? Okay, making that list together and then looking at it and discussing each one. And then zeroing in on where are the roadblocks, where are the challenges. And then lastly here, imagine the extremes. So what would be the worst thing that could happen if you stopped this medicine or took this medicine? What's the best thing that could happen? Letting them really think through that themselves, but offering them kind of the platform to think about it, can help people get thinking and help hopefully find their own motivation. Tip 4, explain risks and benefits. So clearly explain the risks and benefits, explaining the nature or the severity of it. Also using words and visuals such as icon arrays, which are, you might see like a bunch of little people and like 2 are colored in, to explain something like side effects, like 2 out of 10 people will have this side effect. It's pretty low. But anyway, using visuals, charts, graphs, you don't want to get too complicated with charts and graphs, but simple charts and graphs can help you walk them through the pros, cons, the risks and benefits. And then tip 5, oh wait, where am I? Oh, it's tip 4, sorry. Yes, it should be tip 4, that's okay. Explain the medicine's risks and benefits. Yeah, keep going, Jeremy. Yeah, right there. So some examples, the COVID booster may make you feel tired, your arm may hurt. And then what about these or other concerns that may cause you to delay your booster or your shot? Or talk about the benefits of the medicine. So this medicine should help your COVID symptoms get better faster. How does that sound to you? What do you think about that? So helping them explore risks and benefits in that way. And then lastly is using follow-up. So this is like tools to help you. So communication again with a pharmacist. Can you link them up with a good pharmacist who will learn their name and know who they are so that when they pick it up, they can ask their questions and they kind of, build that relationship. Phone calls, text reminders, are there systems that can do that? That's kind of getting into system level barriers. And then tools they can use at home. This helps you remind people about their medicines and address their concerns. And then the tools might be, on the next slide, Jeremy, tools might be like a tabletop timer. I know that in the past I've worked with clients that just wanted a visual reminder on their kitchen counter for when to take their medicine. They didn't want a digital thing. They didn't want an alarm on their clock, on their phone. They wanted that. Medicine bottle caps that include a timer, they make those. There are services that sort multiple medicines into packs of daily doses. So you're taking these 10 medicines and it will package them by day. And then, of course, there's all kinds of smart apps. And then there's also just the old school pill boxes that I'm sure a lot of you have tried. So we're 1 minute over, but we've reached the end. There are some resources that we've included here. We will include this in the one-page summary that we send out along with the survey. And we can, Jeremy, I guess I can paste it. I can paste in the survey real quick. Oh, there it is. Okay. Hopefully this link works for you to take the post survey. Thank you all for participating, and I hope that this was helpful to you. Thank you.